Hairstylists and cosmetologists. Ever have clients with issues after styling? If not yet, it could just be a matter of time. What if I told you that there's a way to avoid hairstyling mistakes? Would you be interested? Braids and extensions have been fashion staples for decades, allowing for many different styles an individual can choose to wear. But sometimes braids can lead to unwanted outcomes, such as this, or this, or this. But what if I told you that there's a way to hair loss due to braiding risk can be 100% preventable and ensure confident client outcomes? Are you interested in learning how? Hello, I'm Dr. Seymour Weaver, a board-certified dermatologist, medical hair loss expert, and hair loss educator. Over my years in practice, I've diagnosed and treated tens of thousands of individuals with hair loss. I've utilized my expertise to assist numerous cosmetologists and hairstylists in helping clients with a variety of hair and scalp issues. Today we're going to cover 3 tips. The first is how to recognize traction folliculitis. Pimple-like bumps can appear due to tension or pulling on hair follicles. This condition is called traction folliculitis. It's a sign that the hair follicle is being injured and hair loss can follow. The cause of the excessive tightness needs to be removed. If pustules appear, then excessive tightness needs to be stopped. Recognizing these pimple warning signs and relieving tightness promptly aids scalp healing. If the pimples are ignored and the tension and tightness continues, then baldness happens. Tip 2, how to recognize the fringe sign. With prolonged tension, a line of hair growth develops around the edges of the hairline. The border of the hair growth is called the fringe sign. It's characteristic of traction alopecia. The fringe sign helps identify traction alopecia from other causes of hair loss. After noticing the fringe sign, hair loss may worsen without altering the styling techniques. Paying attention to the early appearance of the fringe sign is a key way to stop traction alopecia from worsening. The hair loss can progressively worsen if the tension continues, and the fringe sign can be all that's left behind. Tip 3, stop the tightness and get help. Pustules are present. The fringe sign is beginning to appear. The hairstyle should be changed, but it hasn't. Continuing to do the same hairstyle when the fringe sign and the pustules are present will only lead to more worsening of the hair loss. A bald area of the scalp being covered by a hairpiece can also cause traction. Small pustules are developing around the edges where the hair is attached, suggestive of traction folliculitis. If this is ignored, the condition can progress to lead to traction alopecia, which means that the area of hair loss being covered with the extension will get larger and larger, so the process of trying to cover up the bald spot is making it get worse and worse. This person developed an extensive fringe sign with just fine hair left in a band across the frontal area of the hair loss. It's really too short to attach braids to, but the braiding on the top continued. And so, as you notice, the hair loss has worsened. The area to attach hair braids to is extensive, and ignoring the fringe sign and continuing to braid the hair causes the condition to progressively worsen. Once the condition is too far gone for hair to grow back, only scar tissue is left behind. Traction alopecia surveillance, putting the tips into action. Stay on the lookout for the signs of traction alopecia to help your clients that get braids keep their hair. Be on the lookout for the follicular pustules, be on the lookout on the fringe sign, be on the lookout on the need to change the way the hair is being styled. This person has a fringe sign, they need to change their hairstyle to prevent further hair loss. What to do about hair that's already been lost? Change the hairstyle first. The source of tension must be eliminated. Essential oils are available and could be helpful. Topical minoxidil might help. Seek medical attention if needed. Medical treatment options include topical anti-inflammatory medications, scalp injection with steroid medications, platelet-rich plasma or PRP treatments, hair transplant surgery. In this individual, she stopped her braiding, the pustules were gone, but she still had a fringe sign and she still had hair loss remaining. She opted to get medical treatment, with topical medications, including steroid injections, and her hair growth improved in 3 months. Doing treatment helped, but if she did not change her hairstyle, it would not have done her any good. Options for medical treatment can sometimes help, but other times they don't. It depends on how early the condition and what stage it's in at the time the treatment is initiated. With a focus on recognizing problems early, the beautiful styles can be worn with confidence. You can help clients to wear these styles and keep their hair by being on alert. Watch our entire collection of educational videos. Let's continue on this journey together to improve your expertise and stop hair loss and get hair growing again. These tips can be useful to help any of your individuals that you care for that are at risk for developing traction folliculitis and traction alopecia. Join me as we uncover the secrets to healthy hair and enhance your expertise as a professional stylist. Thanks for tuning in. I'm Dr. Seymour Weaver.